It's so different today. Rush, rush, rush. For example, and you can't get to see a doctor, and you can't get an appointment.
This is Doctor Patient, a podcast that examines all the aspects of the patient-provider relationship. I'm your host, Heather Johnston, MD, a real-life doctor and patient. Today's episode is about how medicine used to be practiced and received by patients. Before the expansion of Medicare and the rise of private insurance companies, things were done a little differently, and I think it's important to reflect back on what worked then that we've lost today. My first guest is Johnston, and yes, she is my mom. I come from a big medical family. Both my parents, some siblings, and a grandparent were all in healthcare in some shape or form. And so the topics that this podcast examines were and are frequently dinner conversation in our house. My mom and I talked about her training, what she remembers about the early years of my dad being an internist, and tells a couple of stories of her own healthcare recently that bring to light some of the common challenges patients face and how those are received by an older and aging population. A word about sound quality here. Both interviews in this episode were done in someone's home with a handheld mic being passed back and forth. And that sound you'll hear during the second guest's interview, that's called a grandfather clock for those of you who don't know. Just roll with it.
I started as a nursing student in about 1950. I did 4 years of training and then received another certification as an infectious disease nurse. Then I went to do plastic surgery but didn't like it. So left and went to do private duty in London. I came to America. I got a job here in Chicago while I was in England and came in 1957 and came to a hospital in Chicago. And nursing was so different. It was so different. So, one of the differences was that in England, we had to do rounds with doctors, and we also had to learn about diseases. We had to know how to write a history of a patient, and we removed sutures, we shortened drains after surgery. We did a lot of things that the American nurse didn't do. Now, I think today the nurses who are nurse practitioners do a lot of things that we did, and they're very well qualified. So it was different.
When you think back to when you were a nurse, and then when you saw Dad in practice also, what do you think is the most significant change in how healthcare providers, nurses, and doctors interact with their patients now versus back then?
Well, I think one of the big differences is time. Time spent the doctor with the patient. My husband, who is a doctor, used to spend 1 hour, 45 minutes, or 30 minutes with each patient. And now you go in to see a doctor and you're thinking, my God, I really have to talk quickly. And I have to get it all out so fast, or I will be out of here in 10 or 15 minutes and I will have missed something. So I think time is the biggest change.
I want to talk a little bit about trust. Where do you think trust has gone between a patient and their doctor?
Doctors, when I first came to America, were considered the group of people that were most admired in the United States. And now I talk about medicine and doctor relationships with people, and people just, there isn't the trust anymore. It's more like a business transaction. Whereas before, when you went to see your doctor, he really knew you. He knew how many children you had, what you did. He just knew you, and now it is so rushed that you can't really form a relationship with a doctor anymore. You feel that they have one foot out the door as they come in the door.
When Dad was still practicing, do you remember him getting calls in the middle of the night and on weekends? And if so, was he ever upset by that or annoyed by that, or no?
Not at all. He had calls in the middle of the night. He was gone on Christmas days, and we had small children, and the father was gone. He never complained about going out in the middle of the night to make a house call. In fact, if the patient needed hospital care, he would put them in his own car and drive them there rather than call an ambulance. He was that sort of doctor. He also had the ability to come home and immediately go to sleep. That's why he did the middle of the night feeding on our babies, because he had the ability to go back to sleep immediately, and his wife didn't.
I asked my mom to talk about her recent experiences with the healthcare system. This story is sort of crazy, but I think some of you will be able to relate to it anyway. It's a story about how the rules got in the way of meeting the needs of the patient and of the practical and moral right thing to do. I honestly think this kind of thing happened way less in the old days when doctors had a bit more freedom to their day.
Once early in the morning, like 5:30 a.m., I fainted. And when I came to, I felt really weird. I mean, I was drenched in sweat. My heart was pounding. And I sort of crawled to the bed and lay down. I never felt so strange in my life. I mean, really strange. And I didn't do anything about it. And met my daughter in Costco, who said if you passed out, you have to see a doctor. So I went.
Brilliant.
Yes.
Brilliant daughter.
Brilliant daughter. So I decided to telephone, but the telephones weren't working. So I got in my car and drove to the office and walked through the door and said, I was really sorry to bother anybody, but I had passed out. My daughter, who was a doctor, said I needed to be seen. So I was put in a room and a nurse came in and asked me questions. And I was wearing a heart monitor at the time that I passed out. So that was sort of aside. And the nurse went to talk to my doctor, came back and told me I should drive to this suburb or that suburb, two places, because they weren't taking emergencies that day. And I thought, well, if I fainted in my house, what if I fainted in the car driving a long way? I could kill somebody. So I just went home.
So they didn't do anything? I mean, did they examine you? Did they do an EKG? Did they take your pulse? Anything?
They might have taken my pulse and my blood pressure, but I had no EKG. Okay. And then the results came in from the monitor that I had been wearing. And it turned out that my heart had paused 4 times, 8 seconds, 6 seconds, 4 seconds, and 2 seconds. And as soon as I called the doctor to tell her, I got a panicked call back in about 2 minutes. Sort of so sorry. But really, I feel that somebody should have dealt with me when I went in, especially as I was a long-standing patient there, and I had never complained about anything that wasn't a real problem.
Interjecting here to give some more info. It's pretty bad form to have someone in your waiting room who has a pacemaker and a heart problem who's reporting that they have fainted and then refuse to see them and tell them to get in their car and drive 20 or 30 minutes away to another clinic. This should not happen. A couple months after this experience, she had another problem getting through to her doctor's office.
A couple of months ago, I started getting short of breath, and I started getting numerous PVCs, and I have a pacemaker in situ, and I'm nearly 90. And so I called the phone number on the doctor's cards, and the phone number, which was the same that I'd been given for the pacemaker department, and no one ever answered the phone. It rang and rang and rang, and then it clicked off. And then I tried again and again and again. I couldn't get through to the cardiology department. I couldn't get through to the pacemaker department. It was a nightmare. Finally, a nurse called me from cardiology, and they decided they would like to do an echocardiogram. This was beginning of February, but the first appointment was in April. And my daughter called and managed to get it changed to March. Eventually, about 6 or 7 weeks later, I got to see a cardiology nurse who was really nice, knowledgeable, wonderful rapport. And but should it have taken 6 to 8 weeks to get an appointment, to be seen, to get a test? What do ordinary people do? Should I have gone to the emergency room? But having been in charge of an emergency room, emergencies were considered things that had happened in the last 24, 36 hours. And I had had this for a week or two before I began to get worried. So my son, who is a doctor, came with me for the cardiology visit. And he said, just walk through the doors to the cardiology department and say, I need to be seen. And I thought, well, they really couldn't turn you away because there would be such legal liability. But I've now learned that you're in a professional building, and so they can just say, no, you need to go to the emergency room. And by the way, we need an ambulance to transport you because of legal liability. So, oh, what a tangled web it is.
Do you feel comfortable pushing back on a doctor?
No, I don't. But I also think that I probably am a bit more mouthy than a lot of my friends. No, I think that I grew, as a nurse, doctors were gods. I mean, you didn't, in the olden days in England, you really never said anything to a doctor. Of course, I found that in America you could say a bit more. But I think that's almost ingrained. But I don't have the respect for doctors today that I did before, though I have some very good ones. Some of the doctors I have are good.
What's your take on the internet being a patient? I'm asking because I think many of us think it has changed medicine forever in multiple ways. And I'm curious what you think about that.
People my age didn't grow up with computers, iPads, iPhones. It's a big mystery to me. And I think that being nearly 90, I'm reasonably good. But it is so difficult to deal with messages. And the other day, I received a report of an echocardiogram. It seems now that doctors have to send all lab results and things to the patient. Well, it was you couldn't understand a word of it. It was reams and reams of mathematical equations and God knows what. And it seemed to me that was pretty foolish. Why didn't you see your doctor and your doctor explain in a manner in which you could understand what the test showed? Not pages coming to you on your computer of algorithms and God knows what.
Yeah, I think this happens a lot in medicine. And it seems like the move into technology, particularly in the arena of communication between doctors and patients, is really challenging for our aging population. And it's happening because it saves time and money to do it this way, but it's certainly not as hands-on as things used to be and doesn't work for many patients. My second guest today is Dr. Jack Martin from Chicago, a pulmonologist for decades, starting in the 1970s. Dr. Martin and I chatted about what he sees as having changed in the delivery of medical care today, but we started by discussing how things were for him as the doctor, starting with billing. When I was in practice, I was working at a big academic medical center, the University of Chicago. There, after I finished with each patient, I had to check some boxes to indicate what's called the level of care that I gave. That lets the billing staff know how much to bill the insurance company and the patient for. The checkboxes incorporate how much time you spend in the room, how many questions you ask, how many organ systems you go over, how detailed you get, and how much help you ultimately give. But it used to be really, really different.
Well, when I started in practice, there were people we just never billed. We never billed doctors, we didn't bill nurses, we never billed clergy. You just didn't. That was...
Out of respect.
Respect, not a rule.
Acknowledgement.
We just didn't. Mm-hmm. And when we would charge patients, sometimes we'd charge patients that didn't have much money, we'd charge them less. And sometimes people that had more money, they'd pay, for 15 minutes, they'd pay a few bucks more. That took care of the patient that didn't have any much money, and so paid a little bit less. And then insurance came along, where you had to document everything, and I don't know. That was the start of what I guess I would call, what was the word we used? Mechanization? Yes. Because it was just so many check marks, and if you didn't have the check marks, you weren't really supposed to bill them, because that supposedly was fraud. But as I tell people who would listen, when a patient walks into my office, I don't write down that their eyes are not yellow, that they walk normally, that they don't limp, that they don't slur their words. I only put those things down if their eyes are yellow, if they slur their words. And so to have to put into a computer all these things are normal, quite frankly, is a waste of my time, and it's a waste of the patient's time, and it's really stupid.
You know that Joe is a clergy member. Who decided that Joe did not get a bill?
You did. You were the doctor.
You were the doctor.
You were the doctor. You decided.
Doctors had power over billing? What?
Absolutely.
Unthinkable.
Absolutely. That was that was a nice thing about having your own practice. And this is just an aside, but I went to see the dentist, I don't know, 6 or 7 months ago, and it was just a routine kind of thing. And when I came out, the lady at the desk handed me a slip of paper, and there was no charge. I said, "What do you mean, no charge?" She said, "Yeah." I said, "Well, that can't be right." So the doctor came out, and I said, have to get rid of him. "Chris, this is wrong." I said, "There should be a charge." He said, "No, there's no charge." I said, "Why is that?" He says, "Because I can."
Oh.
Just his practice. He said, "Because I can." And I thought, my God, how neat is that? Just how neat.
Yeah. I don't know anyone that practices that way. I love that story, though. Everyone I know is in a group with a system, bound by a million rules, and they have nothing to do with billing at all. They would have no idea.
Yeah, and then when I read that the number of physicians whose practices are owned by hospitals who fall into this, I don't know, corporate, you got to make this much money, you got to check these many boxes, you got to see that many patients. I say that to me is sad. Because one of the nice things about medicine, and I'd forgotten this when we were first talking, is you essentially owned your own business. And so when you own your own business, you put forth your own philosophy, your own... it's no different than having a candy store if you own the candy store. It's your business. This is the way I treat my customers. This is the way I'll treat my patients. It's really neat. And now you go to work for the big candy factory. No, you can't do that. Now you got to sell so many boxes of candy, and we got to sell more nuts and more pecans than walnuts because we got a whole bunch of pecans we don't know what to do with.
What are your relationships like with your own doctors now?
So this physician I've only seen once, but it's a good relationship. It's practical, down to earth, not in a hurry. I'm sure he fills out all the boxes and does all that, but he does it really quite well. The GI guy that I see, he doesn't even have a computer in his office. He told me one time how he did it. He said, after all the patients leave, he said, I dictate a summary, then I have somebody do something with the computer that keeps the billing people happy. And I'm sure it costs him money not to have a computer, but he said, I can't practice that way.
Yeah, I felt the same way in that ER. It felt very uncomfortable, especially if you were trained before the time of the computers in the room. It feels really wrong. And on the patient end of it, I can say, I do not like it when my doctor is typing on the computer while I'm talking. I really don't. I don't like that. It makes me feel like I'm not being listened to.
I never had occasion to do that, and I don't know. I don't think I could do a computer and deal with the patient at the same time. I don't think I have that skill.
How about this? My mom was short of breath a couple of weeks ago, and the hospital provider set her up with a telehealth appointment with a pulmonologist.
I'm sorry, a little taken away. I don't think I could do that on a television screen.
Well, certainly you can't hear their lung sounds.
No, you can't. Oh, right, you can't. My daughter has a couple of kids, and one of the kids was having trouble with breathing, and she went to see the pediatrician, and the pediatrician was listening to the kid through his shirt.
I hate that.
And she told him, she said, look, my dad's a pulmonologist. You can't hear a damn thing through that. Pull up his shirt and listen to his chest.
Good for her. Good for her.
That's probably got to be edited out, but it was.
Nah.
But to tell you how bad things are, the AMA has a picture when they're talking about a doctor, some doctor listening to somebody through their shirt, and I think that's just absolutely gross.
Me too.
And it just pisses me.
Actually, one of the courses I taught at the U of C Med School was physical diagnosis. I'm a stickler for the rules. I can't stand stuff like that. But I feel like now there's so many things a doctor has to do in a day. I was interviewing, I interviewed my brother a few weeks ago. He's a brilliant internist, really smartest I've ever known. And he is the director of a county clinic in California. And just to hear about his day is ridiculous. It's ridiculous. He gets up at 4 because he wants to get to the office by 5:30. He starts work at 8, but he said on average he has about 100 test results or chart updates or messages to answer every day. And if he doesn't go in at that time to do it, there is no time built into his day to be able to do that. And I've thought, how is it getting so much worse like this? And he's actually sort of a stickler also that things should be done the right ways. But, how is this right? There's no time in the day to communicate with anybody. He's too busy billing and checking boxes and seeing patients.
I never got paid for spending an hour or an hour and a half a day reading a journal, or more than one journal. It just seemed to be, everything seemed to have to be pushed in. And I'm not saying that physicians don't make a good living, because they do. So do plumbers. They make a very good living. And there's a shortage of plumbers, by the way. I told one of my grandkids, I said, be a plumber. I said, right now, plumber walks into your house. I said, it's a minimum of $125 for him to say, or her to say hello to you.
Yeah.
And it's going to get worse because nobody wants to go into plumbing. I said, and it's very nice. At the end of the day, you leave and you don't have any journals to read. You don't have any checkbox. There's no insurance to pay. They just pay you.
Yeah.
It's not bad. It really isn't bad. And when you equate medicine and plumbing today, I think that's a sad state of affairs. That's not medicine.
I wonder what needs to change. What do you think needs to change to bring the focus of those interactions back to the human scale of just having an interaction and a relationship with somebody?
I'm not sure it's going to change. I think medicine is going to continue to become more mechanized, if that's the right word. And it will be taken, when you go to see the doctor, it'll be like taking your car to see a mechanic. They'll replace this, replace that, do this test, do that test, hook up the computer, and then they'll have a program as to what you do, and there will be no place for you to have a discussion with the patient to say, well, listen, this is what they recommend, but I don't think that fits for you, and this is the reason why. I
have been noticing lately when I go to the doctor that the medical assistants who come in first to take your vital signs, now they just roll in a tower with an automatic blood pressure cuff, an automatic, which also tells them your heart rate, all of it. It is all like that. So no one really touches you anymore.
That's right.
You're just like hooked up to this tower for a couple of seconds, and then all your numbers are done, and then you go into the office with the computer. It's just ridiculous. It's ridiculous, really. Yeah, I have found that it's good and bad to be a doctor-patient. I know too much. Sometimes I think I know more about something than I do. Like with the breast cancer thing, I was reading breast cancer journals. I'm not a breast surgeon. I don't know, but I read all the articles myself because I don't trust anyone. I think that doctors often get special treatment, a little more time, a little more conversation. I've wondered about that. I
think they probably do.
But it might be because we are more engaging patients.
That could be, and it could be because, like in so much of the world, if you demand something, you tend to get it. So it might be just our demeanor and the way we behave is that we get more time because we don't give them a choice. Yeah. We say, no, wait, why am I taking this pill again? And I know most patients don't do that.
Yeah. Is that the advice that you give to your family members, to question?
Oh, absolutely.
Yeah.
Absolutely. Say, just ask them, what are they doing? And, if you have any questions, say, well, what do you think about a second opinion? I had patients that say, sometimes I just say, why don't you get a second opinion? Why not? Because it would make them feel better. I didn't think the results were going to be any different. If they were, that was great. I'd learn something too. But I'd say, well, listen, I know this great guy at Rush, or this great guy at the University of Chicago, or the great guy at Northwestern. Why don't you go see him, see what they think about what we're doing?
Yeah, I think that patients think that doctors will be upset by that, but most that I talk to say they are not upset by patients getting second opinions.
Well, I think that's true. And I've told my family members that. I said, when you say to a doctor, I think I'd like a second opinion, most of the doctors that I know say, I think that's a great idea. Why don't you? Because for the same reason I just articulated. One is that will make the patient feel better. And two, if they come back with a different second opinion, the doctors learn something at essentially no cost.
Yeah. It's like free CME.
That's right.
That's so true. So true. Thanks for listening today. To catch up on more episodes and to get new ones delivered directly to you, subscribe wherever you find your podcasts: Apple, Google, Spotify, iHeartRadio, and more. If you'd like to be a guest or have an idea for an episode, Let me know at www.drpatientpodcast.com. That's drpatientpodcast.com. Here's the disclaimer. Even though I am a doctor, I'm not your doctor. These stories, my comments, and all discussion is purely reflection about what's working in the healthcare system and what isn't. Don't use any medical information that you hear in these episodes to diagnose or treat yourself. If you have a question about your health, get in touch with your doctor or local health clinic.